Imagine a day when simple tasks feel incredibly difficult, or your thoughts seem foggy and slow. This can be especially concerning when you are managing a condition like chronic obstructive pulmonary disease, often referred to as COPD. How do you know when that mental fogginess is just a bad day or a sign of something more serious that needs urgent medical attention? If you or a loved one with chronic obstructive pulmonary disease experiences new or worsening confusion, disorientation, or any significant change in mental state, you should call your doctor or seek emergency care immediately. These symptoms are critical signals that often indicate a serious change in your health and requiring prompt medical evaluation. Confusion in chronic obstructive pulmonary disease patients often points to a serious issue with gas exchange in the lungs. When your lungs struggle to get enough oxygen into your bloodstream, or when they cannot efficiently remove enough carbon dioxide from your body, these imbalances directly affect your brain function. High levels of carbon dioxide, known as hypercapnia, or dangerously low oxygen levels, called hypoxia, can both lead to symptoms like confusion, drowsiness, and even agitation, because your brain is not receiving the optimal environment it needs to operate. First, assess the severity of the confusion. Are you having trouble remembering simple things, or are you completely disoriented about where you are or who people are? If the confusion is sudden and severe, or rapidly worsening, consider it an emergency. Next, check for other accompanying symptoms. Look for increased shortness of breath, a change in the color or amount of your mucus, fever, swelling in your ankles, or unusual drowsiness. If possible, measure your oxygen saturation levels with a pulse oximeter. A reading below 90%, especially if it is a drop from your usual baseline, is a strong indicator to seek help. Also, observe if there is any difficulty speaking clearly or maintaining a conversation, as this can also be a sign of impaired brain function due to respiratory issues. These symptoms might indicate what is known as an acute exacerbation, which is a sudden worsening of your chronic obstructive pulmonary disease symptoms or a respiratory infection. Early recognition and treatment are crucial because delays can lead to more severe complications like respiratory failure. Medical professionals will often assess your arterial blood gases to get a precise measure of your oxygen and carbon dioxide levels, guiding their treatment to restore balance and improve your mental clarity. Understanding these signs and knowing when to act can make a significant difference in managing your chronic obstructive pulmonary disease and protecting your overall health. By recognizing the critical link between your lung function and your mental clarity, you empower yourself to respond effectively and get the timely care you need to breathe easier and think clearer.